Starting 6:30, call to order.
You know, I'm a stickler for the rules.
I see. Yeah, you're worse than me. And I see no participants other than expected of our board, Cindy Luongo and Anthony Chow. So I believe we can move on from public participation. The next thing on the agenda is approval of the minutes from October 26th, which was the Bamboo House appeal, which was not granted. Any thoughts about how the minutes were written?
I'll make a motion to accept them. I didn't see anything at all that was different.
I would second that motion. I agree.
Okay. All in favor, Linehan,
Aye.
Silva?
Aye.
Gorville, aye. Minutes are passed as written. Thank you very much, Cindy, as always. Health Director's report. You're on, Anthony.
All right, sounds good. Thank you, guys. Just a quick update. We do have somebody looking at the Bamboo House space right now. Dan has been great about the process, just working with these individuals to make sure that they have the information they need, if they do potentially want to follow through with the purchase. So we are working with them on that. We had a very, very successful ESL night. Catherine, Jason, and Amy were all present. Laurel was there as well. Fantastic showing. Also, we had community champions there as well. It was just a really good night overall. I think the closet, the free closet was extremely successful. I think at the end of the night they took more than half the stuff that was there, so that was great. I know there were, I believe, 9 tables, including the Boys and Girls Club, Melrose Wakefield, Tufts Healthcare. Lots of different resources and tables were there, so lots of folks had the chance to get their resources. Special shout out to Victoria and Carrie, 2 school nurses from the Wakefield Public Schools. They were really great. They helped us in a pinch when we had some technological issues, but they were fantastic with the people who came to get their vaccines, but also just helping us triage some issues. So again, the school nurses were absolutely wonderful. Yeah, we also worked with cross-cultural as well to provide translation services. So they were really great. Yeah, so ESL night overall was a huge success, and I think it's a great event that we hope to see every year moving forward with more participation from other groups.
This was
I heard
second year, right?
Second year, and I heard that this year, I think soccer signups was the biggest hit. Lots of families were able to sign their kids up for soccer, and I believe basketball as well, I believe. So, yeah, I mean, it's just a great way to connect with them, and I believe even there was a chance for families to even return health paperwork to the school nurses, which is kind of like a benefit, unintended benefit of this. And then Jason also, I believe, met a couple of folks that could use some help with their heating assistance this winter. So
Wow.
just overall a lot of great touch points at this event.
Yeah, the touch point. I didn't capture all of it because as you know, our favorite place to give vaccines seems to be the library. We gave a few. Color went down, but we thank God for Carrie, because she had the keys to the kingdom and the printer, so we were able to do VIS in Portuguese and Spanish.
Yep.
And we were able to just quickly make a printed version of the color information so we could just move on. But it was just yet again such a good idea and concept, but color sometimes we always need to prepare for the backup. And I agree, it was really nice to see the school nurses, and we had of course Melissa and Sandy there as well. What was the budget for this? Because that was an incredible, I mean, that was that all volunteer for the agencies that showed up?
I believe the agencies that showed up, I believe they were volunteer. I don't know if I can speak for all of them, but I believe most of them were volunteer basis. I know the Boys and Girls Club was, but yeah, most of them were volunteer, I believe.
Right. So we weren't, it was pretty impressive. And then of course we have kids who could probably, whose English is terrific, the whole rest of the world puts the day first, then the month. And so every time they, try to put a date in for immunizations and birth date, we have to, we just have to remember this stuff. So it was kind of a reminder in that respect. So yeah, I was happy to participate.
I'm really glad to hear that the local sports groups were there. That's awesome.
Mm,
Because I think whereas some of our youth might speak English, their parents don't. And, with obesity and young people the way it is, being able to really facilitate, like explaining to families what it means to participate in sports and like costs or financial support if it's available, or what it even looks like as far as a commitment. I know I see a lot of folks and their parents just don't even know how to get them involved. So I didn't know that was going to be part of it. I think that's a really great idea.
yeah. I will tell you, even as someone who lived here, trying to get in to the sports system when your kids are kindergartners, it was it was like, where's the secret key? So even then, so yeah, I agree. It's pretty cool. All right.
Yep, and then it sounds like pretty much everything else is moving along. Cindy is currently knee deep in approving permits right now. It is permit season. So basically she'll come back and then she'll bury her head in the sand and just work. Because permits are going fast and furious as we come towards the end of the year. But generally speaking, we have pretty good compliance rate with getting things in on time, especially since the establishment of OpenGov a few years back. So Cindy's just been helping to triage some issues. Cindy will be back, I believe, not this week, but following week. So after Thanksgiving. But yeah, we're moving along. And we're excited to announce that Dan's been working on a cloud-based app for doing inspections. He's been working on this for, I would say, a few months now. But he is field testing it now. So for those of you who don't understand why it's so exciting, except for nerds like us, we've always had WinWham, which is WinWham or Paper, which is a software that is based on your machine. So you are tied to the machine or tied to, not cloud-based services. So you can't it's really hard to access your inspection reports, pull data, it's sort of an antiquated system. So by moving it onto a cloud-based server and also having access on your phone, on your tablets, just by the internet, this new app should really change the way that we record data and make it a whole lot easier to pull information. In the future, we hope to use the information that we get based on, violations we find, based on, best practices that are reported. We want to be able to pull this information and create some sort of dashboard that we can look at and see, maybe it's a seasonal issue, right? Maybe coal holding issues are more likely to happen in the warmer months, right? Or maybe we're looking at, foodborne illness investigations happening at certain times, So, I think this information that's being collected is already being collected, but the way in which it's being collected will be much more valuable this way. So, once we really iron out all the kinks in the software, we would like to do maybe a demonstration for the board, and show how a sample inspection can go.
Town council's going to be so jealous.
Anthony, is this something that can restaurants interface with this app too? Like, could they submit their own information, or could they have access to their inspections on this app as well, or is it just for the inspectors?
I think ideally what we want to be able to eventually produce a forward-facing dashboard. So the restaurants may not be able to access it's possible. Maybe they can access their own metrics too. But I think what we want to do is we want to be able for them to access kind of like a big dashboard of information, how different violations look at different times of year, that sort of thing. But also we want to then start integrating educational materials in there as well to make it easier to access. So if there are questions about temperatures, all that other stuff, it'd be, or anything else, it'll be easier access that way. So, and I think overall, this will help streamline some of our training processes too. I know traditionally we've trained inspectors, new inspectors on the DPH, paper forms. which is great from a theoretical standpoint. It makes them, gain the understanding instead of just checking certain boxes for certain things. They'll actually think it through, figure out where to go in the code to look for certain things. But this app will surely streamline and we'll be able to, pull the codes out of the thick FDA manual. They'll be able to pull these things out more quickly so that people can, learn that a little bit better. So, yeah. So yes, to answer your question, I would hope that restaurants eventually will be able to access this information too. So.
Okay, anything else?
Cindy, am I missing anything? I don't think we had too much since the last meeting. Oh, there is one update. The SJC did have their oral arguments heard. They heard the oral arguments on November 6th. That was, I believe, last Monday, I want to say. Yep, so last Monday they heard their oral arguments. What I can do is I can send the board the link to the recording. Oh, looks like Cindy's audio is not working, but yeah, so I can send the link out to the board if you guys want to listen to what was being discussed. No decision was made that night, which was anticipated. They will be taking that all information that they heard back and consider that information. So we will likely not find out for a month, maybe 2 months. But it's a worthwhile listen. It's a little bit long, but we have nothing better to do.
Right. Okay.
Thank you for sharing that.
Of
Yeah.
course.
I'll take that.
I think too that, I don't know if anybody read the item last night, has a very, very interesting article on the decrease in lung cancer. It went from how where Mass is the top states for lung cancer screenings. And as you go along in the article, one of the ending paragraphs said that eliminating tobacco use and curbing exposures to radon, air pollution, and secondhand smoke were all identified as keys to prevention of lung cancer in the report. Tobacco use is the leading risk factor for lung cancer, accounting to 80 to 90% of the cases. It's a very interesting data, very interesting.
Interesting. I'm getting a lot of articles now coming through on, Medscape and a few, a few just quick health newsletters. And, I'm basically sharing with my patients anything that causes particulates in air. So i.e. smoking flower. And, I hate to say it, but I'm doing a little bit of harm reduction, saying, at least with a gummy, I can understand what your milligrams were in regards, because they don't know what they're doing with their vapes. They don't know what they're doing with their dabs. But I think a lot of, we're finally getting this information, so that, I don't know if you've seen it in the research, but more cardiovascular effects are finally being documented. So we're, it's going to follow a similar path, I think. And it's interesting because, we know that we're following cars that have a quaff of marijuana smoke. And so part of me is like, well, if I can smell it, I at least know to be aware that driver, I want to give some distance to, but certainly not good for them. Certainly not, certainly bad for people who same thing as secondhand smoke. And I don't think we've made that connection. So I'm hoping that we can bridge that education and give it, some attention, because we're this society, we just flip from one thing to another. So it is exciting to know what cancer prevention looks like, but I feel like we've gotten lost in making that a highlight. I think, with all of the attention to COVID, all the attention to how many people we've lost to opiate overdoses, we're better in car accidents because the cars have so many protections, but our old nemesis in cancer has been, I just feel like people kind of numb to it unless they have it, unless they're personally affected. I don't know if you ever thought about that.
I see people that are still concerned about it. Never about skin cancer. Nobody cares about skin cancer. But I feel like people are worried about cancer in organs they can't see. I'll admit I don't have a lot of smokers. My population in East Boston, typically they're just not smokers. There's other stuff, but smoking is not really their thing.
Yeah.
But I think
Well, I mean,
people worry about like breast cancer, pelvic cancers in females, prostate cancer, mysterious abdominal cancer of organs unspecified. So I think it's still on their mind.
Yeah.
I agree with you, Candace. I think it's the fact that you can't see the organ. And I myself am an ex-smoker, quit many, many years ago. And you know how we all were told that, well, because you quit within like 10 years, you're going to have this complete wonderful outlook and this great lungs. And now
Now
they're
you're
saying that
deeply
no, but I go for just x-rays, you know, because of I had pneumonia and stuff. And mine clear. They've never even asked me if I was an ex-smoker. So somewhere it worked for me, but it came from a house. My mother died from lung cancer. And we were exposed to the smoke, the secondhand smoke. And I've taken care of many a patient that was never smoked, but worked in an environment that was heavy, heavy secondhand smoke. And it's interesting because you don't think of what you take in and what you breathe every day. You think everything is great, but it's true. Skin cancer, you see one little spot on your arm or something, or your back and you're running, you're calling, you know. And I
at
don't
the
think
risk
it's
of
because, yeah, we don't have, it's like with skin cancer or something else, like we say, you know, working with the American Cancer Society, you can put block on you. There's something there that you can physically put on that you think is going to protect you. But what is going to protect you from what goes into you? You have no idea.
Right. And I think, you know, it wasn't that long ago that people smoked in restaurants and even hospitals. Right. And then you think of the folks that worked in
Planes?
food service. Yeah.
Yeah.
You know, that were never smokers, but that was their job.
Yeah.
at the risk of oversimplifying it, you know, tobacco use is one of the leading causes of lung cancer. And then tobacco is still the number one preventable cause of death, right? I mean, it's, you know, at the end of the day, cancer, you know, I think cancer prevention falls within, you know, a large scope of prevention and wellness activities, but, you know, the link between tobacco use in its smoked forms as well as smokeless tobacco.
Yeah.
You know, it almost seems to be that sometimes we're overthinking a little bit in terms of, you know, what we should do to help prevent some of these things, right? So I think because of that link, you know, dealing with one thing doesn't preclude us from dealing with all the other ones. So I think when there's a relatively low hanging fruit, you know, which is tobacco here, I think we do have a chance to make a big difference. So
Impact. We certainly have already. Anything else?
I'm all set.
I was alerted that town council is doing some preliminary talk on building usage. And there's talk about the senior center. So the school that the senior center is in has a basement which has a cafeteria, I mean basically a dining room, and the first floor where most of the activities occur. On that basement level, there actually has always been a treatment room for, you know, for when nurses have gone to do blood pressures, or sometimes a podiatrist will come in there. So they've always had that. It sounds like Steve Mayo is just looking at mixed use, you know, different kinds of use for that, and apparently is concerned that even the 5 Common Street is an awkward setup for the health department and Health and Human Services. So, you know, they were starting to wonder whether that whole unit could go over. I have asked our town council rep to please include us in any further discussions. I think, you know, our experience has, even though we're not staff, I feel, you know, that if town councilors are getting a tour of a facility for the thoughts that I think actually in our experience with, you know, Elaine, you've managed the department on short term. I think you have, you know, an understanding of what ideal space should be like. I don't think it's anytime soon, but it's interesting to see what, what they're thinking. And again, it's so interesting to me how town council seems to have, a piece of everything, and I've asked to, please be included in those conversations.
It's the age-old thing, Laurel. I
I
think that
know.
when we say when they build a hospital, they should get a nurse to go
Right,
with them.
yeah,
Design it.
exactly.
Why
So,
not do-
we'll see where that goes. Interestingly enough, after they had that conversation and I left that station for a while and came back, I couldn't believe they were still at it. It's 10 o'clock, but DPW was presenting, on recycling and compost, and it touched upon what sustainability has come to us and asked us about in regards to, the ability of apartment dwellers to have access to recycling. And one of the thoughts that was floated as to whether or not those folks could bring their stuff maybe to the pit. So the pit now has metal, and cardboard, and I don't think you need a pit pass for that, if I understood correctly. You do for everything else. And I thought, it's pretty funny. I said, well, there are other communities that have full-on transfer centers, and it's almost like, well, I guess really we're starting to talk about a transfer center for those people who don't have curbside. So I'm thinking I'm happy for that to be in the purview of DPW and town council, but I think we should be aware, because it was brought to, because we're also overlap with other dumpster permits. We may hear more about it, so just to stay up to date on that. I think that's all. Wake Up has a meeting Tuesday, and I didn't know if you, as the other board members, had anything you thought you wanted on a future agenda, or to make sure that if you feel like something's coming up and you want to discuss it, that we try to do it at least 2 weeks before the next meeting. Just let me know, or let Anthony know directly. And Anthony and I, it's our meeting. I know we're talking about, to be announced, trying to do a tri-board meeting after the first of the year. So we have December. Sometimes we've taken December off. I don't recall when we last were able to do that. But it's a segue to next meeting.
Unless barring anything major, I mean, I don't see. I guess you guys could decide, but I don't see anything major happening in the month of December. I mean,
Yeah.
I think we can. I mean, if we want to, we could. It's not really.
Wait, did you just say
but-
nothing major is happening in December?
Well,
Yeah.
for the
Oh,
board.
I made a
Yeah, yeah.
I made a mistake. Oh, I'm gonna
Are
knock
you
on wood now.
familiar with the man in red?
Yeah, don't forget,
no,
Anthony, who's covering next week when they're the
Oh
two of
yes,
them are on
actually, it's an
vacation,
omen.
Maven.
Elaine's covering for us next week, so everything's about to happen at once. So, I think Elaine
Elaine's
brings
gonna
it
whip
with
that
her,
place
but
into shape.
What? Yeah,
I know.
I don't know if I can, I hope I'll be kind. That's all I think. I don't know, but nothing's gonna happen. I'm gonna put the rosaries in the window this weekend.
Oh, good.
So Elaine,
But
you're
I mean,
covering for Melrose, or the
I'm
whole?
covering for the two nurses will be
nurses.
out, so I'll be doing all the Maven for the 3 towns
Oh, wow.
and
Okay.
all the
Yep.
infectious. Yeah.
Thank you.
Thank you,
and
Elaine.
then
Thank you.
yeah, things
Thank
like
you, Anthony.
oh, thank you, Elaine. It's my pleasure. But anything like like a tri-board meeting, even if we don't have anything worthy of a full meeting, I mean, it wouldn't. I don't think it would be considered deliberation. We could probably just figure out a tri-board meeting over email.
Yeah. Yeah, that's
Yeah.
actually,
That would-
scheduling is expressly identified as not needing to
non-delay, yeah,
comply with open meeting.
not open meeting. Okay,
I really
so
think
I
that
mean,
December, taking that vacation, that's actually Christmas week and Hanukkah, whatever it is. And to be honest with you, I've been doing not only the Wakefield clinics, but I've been helping them with the Stoneham and everything. And I think I think they need a little bit of a break to concentrate on their flu clinics and what's going on and tying everything up for the end of the year. So if nothing comes up, I mean, I agree. Why not we didn't take anything off in the summer, so.
well, the boss has spoken, so I guess we're not having December meeting.
Okay, so then the next meeting then would be the 17th
That's okay.
of January?
Yep, that's okay.
Okay.
Yep.
So 17th of January, does that work for Or did we, Anthony, do you have a sense of what would work for the other board members? When do they usually meet?
So what's funny is actually we usually now have it for some reason. It's all lined up in the same week now, Tuesday, Wednesday, Thursday, of the
Mhm.
same week of each month. So I can ask them. It'll probably be either Tuesday, Wednesday, or Thursday of that week. They're generally pretty flexible.
Okay,
So I mean, it could be Tuesday. So
Maybe we should plan for Wednesday. That's the middle of the week. That's the middle of the 3 days, and the 15th is a holiday.
I think that's the usual day for us anyways, Wednesday. So I think we
Yeah,
should plan
so
for what we should stick with Wednesday, and
stick
then
with
I'll ask the other
Wednesday and,
boards.
yeah, and
Yeah.
ask and invite them.
yeah,
Yep.
give
Do we-
them, give them the heads up soon. And
Yes.
then we should probably, you
Well, it
know,
depends if we have space.
oh, thank you. That's what I forgot to mention.
Also, Laura, you got 3 minutes before I pop off.
Okay, so just so you know, well, you know this, Anthony, so I
Yes.
can let you pop off, but I actually emailed Administrator Mayo and Town Council Chair Chines and our rep from Town Council and Danahy to request a timetable for, to request that we enjoyed and wanted to, and it was our wish to deliberate in a physical setting. And if, because, we were getting word like tonight, there couldn't be a physical setting, that we appreciate the ability to do that. It's part of the joy of our work. If we're deliberating with a lot of packets, it's awkward to be reading things and not be, like I'm kind of old school. So, I think over the years, it used to be, people would be delivered packages, or you would have a package in a meeting. And now it's like, well, yeah, you all have computers. We don't need paper anymore. But, especially when we're deliberating on things that, it just makes more sense. And it's our preference to be live and, in a conference room, and being that we are volunteers who have been giving all our time, I feel like that request should be heeded. I have not heard a response, but
So just to let you guys know, the latest I've heard from Steve and Sherry is that we are going. I mean, in general, not just our board, but in general, physical spaces will be made available to us relatively soon,
Okay.
pending timeline. But that's what they told me relatively
Okay.
soon. Yep.
yeah, so I have not heard a response, and that's what I asked. I said, if this is temporary, now what can we anticipate? So more to follow.
I did ask for another organization. They were looking for a meeting space, and that's what I've been told, that they're trying to make space of more available for town committees, council, and people like us first in the evening, because spaces are so limited, and to make sure there was a Zoom access,
Right.
which
And that it was easy. So that also came up on town council in the meeting the other night. So, here we go. And it was not, tonight was fine because we didn't, we weren't having a
didn't have
public meeting.
anything, but when we do have something, we have to be face
Yeah.
to face.
Yeah, I hear you. Elaine, I advocated for that position exactly. So I just wanted to,
I know.
I
I
didn't-
wasn't the only one in the
I
background.
didn't CC you because I didn't want it to become an open meeting kerfuffle if anybody else
Yep.
commented. So I just thought, I'm like, I'm going to write it and then I'm going to let you know. And I have not heard directly from Steve, but now we've heard through Anthony, and I suppose
Right.
that's okay.
This
Any,
other organization called me back and said to me that that's what they were told, and I said, oh, okay.
yeah. So Anthony, if you could please let us know where and when on the third week of January.
Yep.
And if we as a board can formulate any kind of agenda items to figure out, what the, and certainly Anthony, you need to coordinate with the other boards, but, I'm assuming nicotine-free generation will be up there in anything that is pertinent to us as a region.
Yes, we will have many things to discuss: body work, body art. Be careful what you wish for, Laurel.
My favorite.
It's an issue we all face.
Yeah. Mhm.
Yeah. Yeah. Okay. Anything else before
That's it.
did we really just have a 31-minute meeting?
Right,
meeting?
come on. My shortest on record, I think, was under 30 minutes with me. So come on, Laurel.
I'm waiting for a motion.
I motion,
adjourn.
yeah. I'll second it.
All in favor, Linehan, aye. Silva, aye. Gorville, aye.
Yeah. Mhm.
Good
Everybody
evening.
have a nice
Happy
holiday season.
Thanksgiving.
Happy Thanksgiving, everyone.
Happy
Bye.
Thanksgiving.
Bye,